First, I just introduce myself. My name is Peter Simpson. I'm the financial advisor here at IC Financial Services. As you know, we have the financial services here at IC for investments and retirement planning and full financial planning. So all those types of things. One of the things that we offer is seminars and webinars such as this with our product partners. And so today I'd like to introduce Jeff Clark. He's a regional director for Golden Care USA. And as you all may know, we recently began a partnership with QSO Financial Services here at IC Credit Union. And along with that, we have access to some new product partners. Jeff is one of those, and he's kind enough to share with us his expertise in Medicare today. Jeff has over 25 years of experience with Medicare and Medicare products. He's been partnering with QSO Financial Services for over 12 years. So we really appreciate you being here today, Jeff, and thank you so much. The floor is yours.
Yeah, well, great, Peter. Thank you for having me. First of all, you know, it's a popular time. It's Medicare Advantage season, and so a lot of folks are getting a lot of stuff in their mailbox. At this point, we're getting inundated with commercials with Joe Namath asking you if you're getting all the Medicare benefits you deserve. I think William Shatner also does a question like that. J.J. Jefferson from Good Times. There's a handful. Kelsey Grammer, I think, is on it now. But you'll see a lot of these ads. A lot of carnival barkers, if you will, screaming about what Medicare stuff you should have. And so it is that season. It's probably kind of why we decided to do this seminar when we did. And so today I just want to do this. I want to just try to simplify things if I can. You know, what we do with most of the credit union members all over the country is we just try to explain kind of what Medicare is and what their options are. I think if people can understand it better, it just it puts them in a better position to make a good decision on what might be right for them. So my intent today is just basically to do a 15 to 20 minute kind of an overview of what Medicare is, when you get started, what you need to do, and then if you are indeed entering Medicare, how you can take advantage of some of the services we provide as far as finding you the right plan, depending on your medications, depending on your health, depending on what doctors you might be seeing or specialists you can't live without. We kind of help you find the plans that make the most sense for you. So it's a free service. And anyway, so let me just kind of explain Medicare briefly. And there are in this area here, we have some chat. So, and I will look at this periodically, probably the end of my, okay, that's from my, great. You can see your screen and hear you. Thank you, Corey, for letting us know that. Apparently I'm able to be heard and seen here this presentation. So if you have questions, you can go to the chat area, and probably after about 15 minutes, I'll look at that, and we'll look at some questions then if you want to type something in. Certainly at the end, we'll give you a phone number to call if you want to get more information, etc. But let me go ahead and kind of get started with this. So Medicare. And again, thanks Peter Simpson at IC Federal Credit Union for putting this on for us. So again, this is just giving you an overview. Nothing too deep here. Myself, I think Peter, I explained to you, I've been doing Medicare work for a little over 25 years, and I've worked with QSO for 12 years more now. It seems time flies, but I have done seminars such as this one, live seminars in, I don't know, probably 20 states, 30 states for QSO. And if people kind of often wonder that too, is it Medicare kind of, I should be talking to some of my own area in Massachusetts there. Well, remember, Medicare is a national program. So, it kind of, it follows suit, I guess, everywhere. So we're able to answer questions in all 50 states, no matter where you are in the country. So Massachusetts happens to be an area that I work in a lot personally. I have a lot of great QSO advisors that work in that area. So I've done a ton of work out there, know the market very well. Matter of fact, this is one of the states that I actually oversee the program in. So you'd likely end up working with myself on things in Massachusetts. Okay. So an overview, and again, this information, this is the disclaimer that QSO likes to put out there that they don't want to speak for anything I'm saying per se. Just your standard disclosure here. I'll leave this on the screen for a little bit. Okay, so we're going to go over Medicare A and B, then what Medicare supplements are, what Medicare Advantage plans are. Okay, sometimes those are called Part C. Then we'll talk about prescription drug plans. I always tell people D for drugs. Medicare Part D, and then I'll talk about the enrollment options. So again, short and sweet here, hopefully. But let's just jump into what Medicare is. Okay, so Medicare has been around since '65, right? It provides health coverage to almost 60 million people, projected to be over 81.5 million people by 2030. People who are 65 and older naturally are on Medicare. There are people who have disabilities. So if you become disabled at age 51, once you're on disability for 24 months, you're automatically put on Medicare. Anyone with end-stage renal disease or anyone with Lou Gehrig's or ALS disease will be on Medicare as well. So typically people apply 3 months before turning 65 to get things set up. Okay. So when you start your Medicare, you'll get your card, right? Yes. Medicare, you'll notice on here, there's 2 parts to it, Part A and Part B. Now, I'm going to have a slide for this. And again, some people get this card, maybe they don't activate Part B right away. Maybe some of you are already on Medicare, so you're familiar with this card, but this is what it looks like. So there are 2 parts to Medicare. And this is original Medicare. This has always been Medicare. There's 2 parts, hospital and medical. When I talk about the hospital, we're talking about major things. We're talking about I've had a heart attack, I've had a stroke, I got in a car accident, I'm going to go to the big building, I'm going to be there for 3 days. Okay, that's not. Part B of Medicare is your regular doctor. You know, I've got a cold, I need some antibiotics. I twisted an ankle, I might need an x-ray. Got bronchitis, I need to, go get a lung x-ray, maybe get some antibiotics for that. So that's your Part B of Medicare. A and B, they've been around for a long, long time, since 65. Well, about 12 years ago, 14 years ago, we came up with a new part of Medicare, and that's just Part C. This is the Medicare Advantage stuff we hear so many commercials on this time of year. It's another alternative to how you handle your Medicare. So you got original Medicare, A and B. You got Part C, and then of course, remember, D for drugs, prescription drug coverage. You have to get a drug plan no matter what you do. No matter what you do on Medicare, we have to have a drug plan or you face a penalty. And I'll explain that later. Okay. So Part A, and I kind of touched this already. This is inpatient hospital care. For inpatient care in hospitals, skilled nursing facilities, say you have that stroke, maybe you have to go to a rehab center. A lot of times these are just, areas, they'll move you out of one hospital room, they'll move you down the hall, maybe downstairs, and now you're in a rehab center, skilled nursing facility. It's billed differently, but again, that's all part of A. Some home health care, they send you home with a regiment of nurses coming to see you. That's still part of the Part A as you kind of get better. Then, of course, hospice. If you're not going to get better, you have 6 months of hospice coverage from Part A of Medicare. The under observation inpatient, it's all about billing. I don't want to get you too complicated with this stuff. Medicare does a pretty good job in the hospital. So premium cost for Part A. So what does Part A cost me? Well, Part A doesn't cost you anything if you are someone who has worked for 10 years or more in this country. If you've worked, pay your taxes for 10 years, there is no charge. So if you or your spouse has worked for 10 more years, now if you've only worked for 3 years or something, and then you can apply for Part A, there'll be a prorated a fee for you. I know that Part A runs around $500-600 a month. So that's paid for as being a tax-paying American citizen that's worked for 10 years or more. That's what premiums work on that. Part A. So with Part A of Medicare, when you go to the hospital, you are responsible for $1,556 each hospital stay. Now, this could be one continuous stay. Maybe you're there for three days, 13 days, 40 days. Once you go home and recover, a new hospital stay is another deductible. But essentially, $1,556 as soon as you check in. Okay, now there's a co-insurance here. If your days, if you're there day 61 through 90, it's $389 a day. After day 91, it's $770 a day. This is rare. I'm telling you, this is less than 1%. This is just very, very rarely will happen. They'll move you to a rehab center, a skilled nursing facility. It's very rare that you see people end up hitting the 61 or day 90 or beyond 91. Essentially, Medicare is kind of running out of money in a lot of ways. They cut back on a lot of things. They try to get you out of the hospital as soon as they can. So you are going to get hit with the $1,556 deductible each time you get, go to the hospital. Part B, and by the way, that $1,556, that's covered by most Medicare supplements or Medicare Advantages, and I'll come back to that as well. So Part B, a little further. So this is your doctors. Like I mentioned, you go see a local doctor, you need an antibiotic, or you twisted an ankle, you cracked a rib, maybe you're having your knee looked at. So this is outpatient care, durable medical equipment, home and healthcare therapy, diagnostic tests, MRIs, EKGs, all kinds of preventative services. This is Part B of Medicare. And how this is set up is Medicare covers 80% of 80% of all the care. You're responsible for 20%. After you pay a $233, once your, matter of fact, that number has been reduced to $226 for 2023. Those numbers just came out. So you pay $226 and then you pay 20% of everything you do. So if an MRI is, I don't know, $2,000, you're going to be paying $400 for that. So this, again, this 20% and this, deductibles, these are other costs that either a Medicare supplement or a Medicare Advantage plan will pick up for you. Okay, what's the cost for Part B? Now this is one that we actually pay for. Remember, Part A is free. Part B costs $170.10. As a matter of fact, we just got the numbers out on this. I apologize, I should have updated this, but it's $164.90 is what it is for 2023, the upcoming year here. This is the premium in 22, but those numbers just came out from CMS here, so it is $164.90. That's what you'll pay for Part B. Now, if you're someone who has a lower income, maybe you qualify for some other state or national help with things, sometimes they'll prorate that be lower. Some people pay $100 or $90. Some people make too much money. If you're a married couple, you make over $187,000, you're going to actually pay a little bit more for Part B. That's about 300 and some. So there are different income related brackets for this, but for the most of the country, most of us will pay this $170 per month. Okay. Now, you can have this come out of your checking account, or a lot of people, once they are on Social Security, they have it just deducted right from the Social Security account. So Part A and Part B are standard parts of Medicare that have been around since the very beginning. You automatically get A when you turn 65 in this country. Okay, Part B, you can activate this when you want. Some people are working beyond their 65th birthday. They don't want to activate Part B and pay $170 a month if they're getting coverage through their work. So a lot of times I get calls from folks that are asking, do I need to worry about turning 65? I'm covered through work and I intend to keep working for 3 years. Can I just keep my insurance I've got? And the answer is yes. There's no penalty for not signing up for Part B if you're still working and still have what they call credible coverage, which is essentially you just have insurance somewhere else. Okay. Same with drug coverage. If you turn 65 and you don't pick up a drug plan, as long as you have drug coverage through your employer, through your spouse's employer plan, or however you're getting your insurance, there's no penalties if you have insurance on your own. Okay. Hope I haven't lost too many of you. So the Part B, all right. So this again, the $233 and the 20% copay insurance, Medicare pays 80%, you pay 20%. And there's also an annual deductible of $233. That's be met once a year. So, all right. Exclusions. Just kind of take note that Medicare typically doesn't cover, I call it ears, teeth, and eyes, but yeah, vision, dental, hearing, eyeglasses, cosmetic, acupuncture, long-term care, nursing home care. So a lot of times we're watching commercials right now where they're going to be asking you, free dental coverage, vision coverage, hearing aids, everything's free. Just be a little mindful that Medicare doesn't cover this stuff typically. So some of these plans are trying to, woo people over to them by giving them a free teeth cleaning, or maybe they'll give them a free eye exam once a year. And so be careful what you hear sometimes about free everything, free insurance or free dental. A lot of times it has to use their networks. There's only certain procedures they cover. So every plan's different. So I just kind of urge you to just a general rule, know that Medicare really doesn't pay for things like getting, a nice pair of eyeglasses or some contact lenses, or maybe you want your teeth whitened, or maybe you want some really expensive hearing aids. These are all things that typically Medicare doesn't cover. Medicare does cover vision if for example, you have an attached retina, or you need to have, cataract surgery. Maybe you got in a car accident and broke your jaw. Well, then yes, dental is covered, reconstructive dental, or that's covered under Medicare because it's medically necessary. Maybe you have an ear infection that ended up rupturing your eardrum and you lost hearing because of it. Well, that's medically necessary for that reason, so that whatever help they're going to offer you there can be covered with Medicare. Generally speaking, they just don't pay for cleanings, fillings, eyeglasses, or hearing aids. So anyways, okay. All right. So let's recap. So that, again, I know that I buzzed through that and it looks like 15 minutes, but there are two parts of Medicare, A and B. Right now, each one of them have the deductibles and co-payments and co-insurances that go with it. So it does create a little gap there, there's some things that you have to kind of take care of on your own. Most cases, original Medicare does not offer prescription drug coverage, so we have to figure out something with that. There are two ways to kind of take care of these gaps, these extras that we have to pay, the part that we're responsible for, supplements or Advantage. I'm going to go into that right now, the difference of those. But then you have to roll in a Part D prescription drug coverage no matter which path you go. So this is a slide that at this point, I'm hoping to clear things up for you. So you start Medicare. There are really two paths to go down. There's only two paths. There used to just be one path, but now there's two. Okay. One path is Medicare Supplement. The other one is Medicare Advantage plans. Medicare Supplements, I'm going to slide for this. Medicare Supplements have been around since the beginning of Medicare. Right when Medicare was designed in 1965, it immediately had gaps. It had, there was a couple holes in coverage. So people immediately started buying supplements, or insurance companies sold supplements to fill in those gaps that Medicare didn't cover. Medicare was never designed to cover everything 100%. And honestly speaking, as we move forward, as we age as a society, the baby boomer population, our senior population is poised to double in the next 10 years. So we are literally, with the Medicare system, we're running out of able-bodied people who are working, paying into a system that's exploding in population. So the supplemental to Medicare market becomes more and more important as Medicare pays less and less. So this is why people have to supplement their Medicare. And so there's two paths to do this: Medicare Supplements and Medicare Advantage plans. I'm going to briefly talk about each one, and I'll try to show you a little example of that. Okay. Let's look at supplements first. This is, supplements are super easy to understand. Part of that is, and I want to bore you, they're standardized. In other words, they're the same no matter which company you get it from. Now in Massachusetts, you have, Core 1 or Core 2. It's just there's two different supplements to pick from. One has a little bit more benefits, one has a little less. It doesn't matter which insurance carrier I get that supplement from. It's exactly the same. So if I'm shopping in Massachusetts, United Healthcare seems to be the strong one out there. But whether it's going to be Mass Health or some of the other players out there, there is no difference in coverage. You are basically fully covered. You don't pay anything. You buy the supplement, you don't pay anything else. So the premium might be, I think in Massachusetts, I'm going to guess, I think it's around 160, 165 there. So you pay 160. There are no copays. There are no deductibles. There are no networks of doctors. Couldn't be easier. Couldn't be simpler. A lot of people just don't want the headaches of the Medicare Advantage plan. They want to pay 165 and be done. That's a Med Supp. Full coverage, very easy. This is here for the rest of the country. Good thing for you folks in Massachusetts. This particular chart, you don't have all these options. Massachusetts has two, basically Supplement 1 and Supplement 2. Okay, I'll show you that in a little bit here. Very basic. Cleans it up in Massachusetts quite a bit. So when you choose a supplement, there are no networks. There are no copays. This coverage is guaranteed renewable. As long as you pay your premium, they can never drop you. Again, the Advantage plans can come and go. This particular plan can be discontinued in any given year, and you have to switch to a new plan. So that's not the case with supplements. As long as you pay your premium, they can never drop you. And it's portable. You leave the great state of Massachusetts, you decide to go to Florida, that coverage will come with you. So they'll convert it to a Florida-style plan, but it is portable. So you do pay a little higher premiums for this, but I don't know. I can tell you nationally, it's about 60% of people go with Med Supps and 40% of people go with Med Advantage. In Massachusetts, that number is a little closer to 55% and 45%. So no right or wrong answer. Depending on your situation, depending on what maybe medications, what doctors you're seeing, Medicare Advantage plans can save some money, but you just have to be a little bit more careful with what doctors you're seeing, what medications you're taking, if you travel a lot, what kind of specialists you need, what kind of doctoring you're doing. So the Medicare supplement's the easy, safe route. $160 a month, you don't have to worry about anything. Okay, so Medicare Advantage, this is also known as Part C of Medicare. All right. These get a little more tricky. Okay, these are managed by private companies. So what's happening here is now, instead of the state of Massachusetts managing, monitoring any individual Massachusetts residents' Medicare for them, that money, that Part A and that Medicare is going over to a private company, and they're going to manage your care for you. And to do that, they have a different set of corresponding copays and deductibles and the way they go ahead and bill things. So you're basically letting a private company administer your Medicare for you. Now that can create some savings. You know, again, depending on the situation, depending on the people, I do myself, you know, depending on the situation, I probably sell 60% Med Sup and 40% Medicare Advantage. Because in some situations, whether lower income or maybe someone that just never goes to the doctor and is super healthy, it makes sense for them to go with an Advantage plan. So with these plans, they often have built-in drug coverage with them. They throw in things like dental cleanings and vision, and so they make it they package it all in for a nice little plan, kind of a comprehensive plan, if you will. And so again, that's kind of how they're monitored. It's a different option. We didn't have this option 10, 15 years ago. The Medicare Advantage plan, their benefits must be equal or at least to what Medicare offers. Okay, your client still pays their Part B premium. It replaces the need for Med Sup. You don't have both. You don't have a Medicare supplement and an Advantage plan. There are lots of kinds of Medicare Advantage plans: PPOs, HMOs, PFFs. I'll kind of go into this a little bit. Even though they're regional plans, you know, each one in their own, every county has their own plans, right? But they are still good for an emergency. So if you buy a Medicare Advantage plan, even though you might be, I don't know, visiting California for the summer, you know, you're out of network. Well, emergencies, they have to cover you. So they're not quite as restrictive as some people like to say, but they do. You have to stay within their network of doctors, and they're kind of like an HMOs used to be back in your working days. All right, so Medicare Advantage plans. There are a variety of them. Again, you'll hear the terms PPO, PFSO, special needs plans for people maybe they're diabetic or have you know, strokes or chronic lung disease, or so there's a lot of different ways that these Medicare Advantage plans fit. But generally speaking, those are the two paths that you have to do. Disadvantages to them, even the advantages, first of all, they are lower in premium. They can include prescription drug plan and have some extra benefits like dental and hearing, gym memberships, things like this. Some plans are going to have all these benefits available. Some have a couple of them available. Some will have them all available. Maybe your particular dentist isn't in that network. So if you can get all this stuff to line up, it can work out really well for people. The disadvantages is that they aren't guaranteed renewable. You know, they might discontinue. They can pull a plan any given year. Well, that's okay. You know, that means it creates for you an opportunity to switch to a different plan. They can't just pull your insurance. You know, each fall, these plans have to announce if they want to do business again for the next fiscal year. So the 2023 plans are out, and if your 2022 plan you were on discontinued, and well, you have a free chance then to go get a different one. So they don't leave you out in the cold. So, but that just means you have to research it, make sure a new plan is going to take your doctors, whatever new specialist you're doing, whatever prescription drugs you might be on. So there's just a little bit more moving around, a little bit more boxes to check, questions to ask. And that's kind of what you get for kind of saving money. As long as you're able to take some change and you can tolerate maybe not being able to see this doctor, or maybe have to go to a different doctor once in a while, you know, the Medicare Advantage can save you some money. So I'll leave it with that. Okay, so remember, two paths. Now, having buzzed through that, let's see, we're at 25 minutes after the hour. I'd like to get done in about a half hour. I want to show you a little bit how we do it. How can we decide what's best for any individual? Well, we literally can break it down right to any zip code in America. And we can see what plans are there, and I can run your medications, I can run your doctors, find out what's in network, what's out of network. So remember, if you go the Medicare supplement path, there's not much work to do. You're just fully covered, done. You know, it's if you go Medicare Advantage, we got a little bit of work to do. We have to check with doctors, we have to check with meds, we have to, you know, make sure things are covered. So let me quickly show you how we do this. And I'll come back. I'm going to answer some questions right after this. I think I maybe had a couple. Maybe before I even do this. Looks like I have. Nope, nothing yet. Okay. Which means I've either confused everyone or, all right. Prescription drug coverage. I did mention this. I'll go into my, so prescription drug coverage, if you do a Medicare supplement, you know, go back to the two paths here. If you do a supplement, you do have to add drug coverage, standalone drug coverage. Medicare Advantage plans sometimes are going to have that drug coverage built in. But if we do need to do a drug plan, it's very simple. These plans range between $7 and $120 per month, naturally, the more drugs or more prescription drugs you're taking, the more comprehensive drug plan you probably need. If you only take one med, a high blood pressure med, or maybe you take no meds, right? Well, then maybe the $7 a month plan is going to be plenty for you. You can change your drug plan each and every year moving forward. So people kind of shop their drug plan this time of year. It's Medicare Advantage, or it's Part D drug plan. It's Medicare's open enrollment period. So this is when you can change your drug plan if you need to. Maybe mid-year last year, you got diagnosed with some condition where you're on a medication that's over $1,000 a month, not currently covered by your drug plan. So you're scrambling to pay the $600-700 with good RX coupons. Well, in the fall, you can change that again. Okay, so you do have to enroll to Part D or you face a penalty. Remember, if you don't have coverage through work. So how you decide which drug plan to go into, how do you decide which supplement to buy? Let me show you briefly that. I'm going to open up the questions and we can wrap this up. So
check out our website, goldencareagent.com,
take you, first of all,
or give us a call at
Medicare.gov.
800-842-7799.
So this is a website that any of you can go to, Medicare.gov, and I would suggest you do familiarize yourself with this. Maybe you have some medications and you just want to see what's right for you. So when I have a client that will come to me and say, well, here's the deal, Jeff, here's my medications. And so I might, I'm going to go to Find Plans. Okay, and I'm going to put a zip code in here, and I actually pulled Fitchburg, Massachusetts. So that's 101420. I'm going to just put drug plans here. Drug plan. I'll put apply. We're going to look for 2023 for next year here. All right, and now here's going to ask you, are you on Medicaid? Do you get any extra help from the government? I'm just going to say I don't get any extra help. Okay, and then do you want to see some comparisons? Yeah, I would love to. All right, and that's it. So now they're going to ask you for your drugs. So I'm just going to make up a couple here. I don't know, there's some common drugs for Medicare. Furosemide, I think it's a water pill. Right, we'll just say 20 milligram, 1 per day. Okay. What else should we do here? How about amlodipine? Just trying to very popular drugs here that I see a lot. And that one will do, actually, this is a 10 milligram tablet, and I take 2 of these a day. So 60 a month. All right. Let's do more expensive ones. Sometimes those darn insulins can be expensive. So I'm not even sure this is insulin. It's Xarelto, I think it is. Yeah. Okay. That one's a little more pricey. It's a tier 2 or 3 drug. All right. So 20 milligram. Yes. And then how about a pretty common, Pepsid AC or Prilosec, which is actually omeprazole, right? That's the
check out our website, goldencareagent.com, or give us a call at 800-842-7799.
I take 1 of those a day, or as needed, unless for 2 days. All right, so I'm done. So now I'm going to go in here. I've already got my zip code. I'm going to pick a couple pharmacies. I'll do CVS. I'll do Walgreens. Let's do Walmart, and maybe a local one here. We'll do Hannaford Supermarket. All right. After this, I hit done. Now this is going to tell me, based on the meds I just gave them, this is going to add up the monthly premium and all the corresponding copays for every plan. And there are 24 drug plans in the zip code. So we have access to all these. So we don't have to guess here. Based on your meds, I can tell you to the penny which plan is the correct one to be on. This WellCare plan is $8.60 a month. Your copays with this plan end up being $16.20. Next one down, AARP's Walgreens plan, $31.90. Your copays in total with premium and everything else ends up being about $16.23. So I don't have to guess at this. If you're sitting there thinking, boy, I don't know what plan to buy, take all that worry out. You don't need to guess. This is a nice tool. This tells us exactly what plan we should be on. Now, I can't tell you what's going to happen mid-year with your drugs. Something might pop up here and there. So, but I can even get more details. If I want to know what the copays are for these meds, I literally can go in here, and depending on the store I want to go to, let's see what CVS is charging, for example. Well, it looks like amlodipine is 0, furosemide is 0, Omeprazole 0. Ooh, Xarelto, $5.99 a month. After deductible, that one's going to cost me $44 a month. So that's an expensive med. That's part of why the prices are up. What if I go over to Walgreens and get that med? Well, if I go over to Walgreens, same thing's going to happen here with this particular plan. 0 for the other 3, but $5.99 for that one, then $44. Any difference anywhere else? Let's see. They're cheaper over at Hannaford. Same thing. So you'll see a lot of times it doesn't matter which pharmacy you go to per se. It's usually, well, if you go to Walmart with this particular plan, they're going to charge you $8, 3, 8 instead of 0. So that's going to be $6.19 a month instead of. So again, and then after deductible, 44 versus 66. I don't have to guess here. That's the nice thing. So that's one of the things we do for you. Lastly here, I'm going to show you this and we'll open it up. If I want to look at your zip code, I'll show you what plans are the best plan. If I want a full coverage med sup, I'm going to go ahead and take a look at this market. And I can already tell you it's going to be United Healthcare is going to be number 1 or right up there. I know that's not right. I'll put G, but these plans are not that. 01420 Worcester, that's fine. Female. So this is going to come up with supplement 1 or 2 is what they call them here. There it is, MA Core, Sup 1. Okay. Let's go to Core. That's what people buy there. So this is like Plan G, like I showed that one. So for Core, you got Blue Cross Up Market, you've got Harvard Pilgrim, you've got ARP at $122.50. That's number 1 in the nation. So they're right there within a couple dollars. Harvard Pilgrim's a local carrier, not rated, of course, but you know, sometimes I like the big A+ rating, the big number 1 in the nation. So if it's same price within $5 of number 1 in the country, I'd probably lean United Healthcare here. How about for supplement 1? Let's look at 1A. So again, I can tell you 165. Yeah, this is the one that's the most popular supplement sold in. So 165 for Harvard, 172 for Medicare. If you're married and if you have if I put the married discounts on there, yeah, then AARP becomes. Yeah, United Healthcare is killing it out there. This is the number 1 sold med sup in the country, A+ rated, and they actually have the lowest rate for married couples. So I look at that one a lot of times. If you're an AARP membership, you get more of a discount. So pretty simple. Remember, that's full coverage. So when people ask how we go about this, we run your meds, we talk about your doctors, see if they're covered. We can look up any plans network. I can look at any zip code in Massachusetts. We can tell you the best plan going. If you don't like AARP, you want to go to Harvard Pilgrim, that's okay with us. We don't care. Typically, you want to stay with a bigger name, maybe Blue Cross or the United Healthcare. So with that, I'm going to go ahead and just turn over to questions. I didn't have a whole lot more, Peter. I hope it's kind of, you know, that some of the carriers we work with all the big ones. You know, Mutual, United Healthcare, Aetna, Cigna, United America, Transamerica, Humana, Anthem, Blue Cross, WellCare. We work with all of them. Not all of them, but most of them. All the reputable. We don't work with some of the B-rated ones. We're only going to bring in the A-rated companies. And in Medicare, you don't want to mess with B-rated companies because it's once you're kind of locked in with them, sometimes you can't leave your supplement. So we have many carriers, every zip code out there. So with that, I'm just going to thank you guys for coming on board. If you have any questions, if you want to have your meds run, maybe take a look at what you've currently got for coverage. Maybe you got an Advantage plan. You want to shop it to see if there's a different one, if there's extra benefits out there. Maybe you want to run your drugs. Maybe you're just entering Medicare in the next couple months and not sure what to do. Give Peter a call. He'll get you my number. We can certainly set up a time and talk for a little bit because, again, in Massachusetts, you will get directed back to me. So, yeah. So, Peter, if you have any questions, let me know. What do we have here? The 2 roads. Okay.
Jeff, thank you so much. I did have a couple of questions that came up. Sure. I'm not sure if there's any that have come in on the chat, but
I've looked. There has not been so far.
Okay. So maybe this might help some other people out there. But when you talked about qualifying for it, you said it's 10 years or more of employment. Right. Is that the same as Social Security where it's by quarters, 40 quarters?
No, I don't think that's similar, but similar program for what your Social Security checks can be. Then it comes to how much your money you make, and so, but it is similar, 40 quarters. Yep, to qualify.
Okay, excellent.
Yep.
And the other thing would be
most people 10 years or more, they're going to be fine.
And the other thing, another one, is there any other programs that you could miss out on if you didn't sign up for it in time?
No, Part B and Part D, right? That's the hospital, hospital and medical. So Part B and Part D are the ones that can get a penalty if you don't do it when you're first eligible.
Gotcha.
So
Okay.
just to make sure people, sometimes people work in this country, Peter, a lot of people work beyond 65 now, right? So the biggest question I get is they're turning 65, they hear there's penalties out there. Well, they're still working, they still have coverage to work, so they don't have to worry about anything until they want to retire. Now, 3 years later, they retire, you then have 60 days to get this Medicare stuff picked up. Otherwise, then you have penalties. So Part B is in boy, Part D is in dog are the two you worry about.
Gotcha. And then one last one, I'm sure you get this all the time. The difference between Medicaid and Medicare, because that's very commonly confused. So where does Medicaid play into all this?
Well, Medicaid's the program to help the impoverished, the poor, the low income. If your income's 23,000 or lower, and that's more or less welfare. And for those folks, they almost always go to Medicare Advantage plans. There are low income Medicare Advantage plans that help them with paying the premiums, help them with paying some of the copays. So more or less, Medicaid is the program for the impoverished, the people with no assets, no incomes. Medicare, of course, is different altogether. That's the insurance plan for people who are 65 or older in this country.
Thank you so much. Okay, so that was all I had. I wanted to ask a few of those questions. That was it. But unless there's anyone else that has a question, you can always call me. The number's right there up on the screen. I'm here at IC. You can go to the IC website. My email address is on there as well. So there's definitely several ways you can contact me. And if you do want to dive a little bit deeper into this, your specific situation, we can have an appointment here, and we can get Jeff on the line and go through it. So Jeff, thank you so much. That was very informative. And I know I got a lot out of it. I'm sure our attendees did as well.
Well, I hope so. There's a handful in here. So any questions? Yeah, just let me know. I can help. Okay.
Excellent. Thank you so much, Jeff.
Thank you, everyone. Yep.
Have a great day, everybody.